Hello and welcome back. I am Jennifer Bierhoff of Liebellen Learning.
And I am Therese Laub of Cicerone Consultants.
And a while back, we talked about the idea of six rights of CTP applications. So we are back today and we are going to talk about the first three rights. And so those first three rights are right patient, right etiology, and right measurement. We're
And the
gonna.
one thing that we need to understand too, Jen, is that we're going to
Mhm,
tie all these rights together, all six
mhm,
of them,
mhm, mhm,
to better understand a
mhm,
process flow in order
mhm.
to apply these cellular tissue products. Just
I
had to get
love
that
that.
in there.
I love that because really they kind of like all like you need to do each one as they kind of present themselves in
Hmm.
order to have the correct documentation to move on to place that CTP. So you're absolutely right. Um, so if we talk about right patient, we kind of talked about this a little bit before we recorded, but there's a lot to the right patient. It's not, so in the right in the six rights of medication, it's is this the right patient, right? You're going to look at you're going to scan their barcode on their wrist. You're going to make sure it's the right patient, right birth date, so you're giving the right medication to the right patient. Here, this means the same thing, you're putting it on the right patient, but it also means so much more than that.
Exactly. We have to make sure that the patient falls into the parameters of what these
Mhm.
cellular tissue products are designed to do, right?
Mhm.
We have a lot of guidelines out there. Medicare has the or the LCDs, there's the
Mhm.
MACs, there's all these things that we need to be aware of. So the
Mhm.
patient that we're considering for a tissue product has to fall within those guidelines to make sure that we're applying it in an appropriate situation.
Well, correct. And then even, is this the right patient overall? Is this a patient that keeps their dressings on? Is this a patient that, really struggles and maybe has to work and has to wash their leg or their foot more often because they're out working?
Hmm.
Or, is this a patient that has reactions to certain dressings and they can't keep them on very long? So all of these other different situations can play into, is this really the right patient to put a CTP on for a long period of time?
Right, exactly. And like you mentioned too, a lot of social determinants of health, right? Do they
Mhm.
have caregivers that are able to help them if they're unable to do it? So there is a
Mhm.
lot that goes into the right patient, I agree.
Yep, so much more than just, is this the right, are we putting this on the right person?
The right person, right?
So if we move on to right etiology, I think that that kind of flows, right? It helps
Hmm.
to say, oh, okay, we have the right patient. Is this the right person for the dressing? As in, we've looked at the entire person to understand that this is the right patient. Is this the right diagnosis?
Hmm.
Did we get
Yeah.
that right?
Yep. Because if we don't have the right diagnosis, we don't have the right care plan, and that's going to come back at us down the road, especially when
Mhm,
audits happen.
mhm,
But
mhm,
yeah, etiology is a risk mitigator too, right? For issues that could
mhm,
happen down the
mhm,
road. Because
mhm,
if we're not diagnosing it correctly, like I
mhm.
said, in the right care plan, then we're going to have issues as we move along.
Well, right. And I mean, it is a high percentage of wounds that do not have the correct diagnosis. I mean, if we think about lower extremity as a whole on a leg,
Hmm.
yeah, that's where a lot of our atypicals happen.
Yep.
So, if you're not making progress, you want to also consider something along those lines as well. So, you need to make sure that this is indeed the right diagnosis for that wound. And like you said, a lot of the LCDs will say, well, did you compress?
Hmm.
Did you do vascular studies?
Right.
Did you offload?
Hmm. You check
And so,
A1Cs, all
like
of that good stuff.
all of that stuff. So it's like, did that happen? And do you have it documented, right? And
Right.
documented appropriately for that etiology so that way when they go back and they look at your documentation, they can say, yes, all of these things have been done for that wound type.
Correct. And mixed etiology is another hiccup for a lot of
Oh,
these patients, right?
mhm, mhm,
So we
mhm,
may think we're dealing with one type of wound, like a
mhm,
venous wound, but when
mhm,
we have arterial involvement as well, that can create a lot of problems. And
mhm,
again, if we're looking at putting that cellular tissue product on, we need to make sure we address all of those underlying conditions that
mhm,
that patient may
mhm,
have so that
mhm.
CTP is successful.
Absolutely. I mean,
Mhm.
truly, we want to set these patients up for success with this. We
Yep.
absolutely do. So you're absolutely right. Which does kind of move on to right measurement, because now we're looking at the assessment, right? So we have to make
Hmm.
sure that we have done our due diligence and have, gotten the right measurements on these wounds.
Hmm.
And that helps us know, has the wound made any progress over the past 30 days? Is it getting better? What's going
Right.
on with the wound? And that'll come into play later on for the other six rights to make sure that we have the right size and things like this. But
Right.
Therese, you and I have gone out all over the country and have done chart reviews.
Hmm.
And
Inconsistency in wound measurements are a big one.
do we have the right, well, I mean, do we have the right diagnosis, which is always the interesting piece? And
Yeah.
then do we have the right assessment? Do we have the right wound measurements?
Yes. And
Yes.
this is huge when it comes to compliance, right?
Yes.
Because as these charts get audited or
Hmm.
looked at or reviewed or whoever's helping you out with that,
Hmm.
you're going to need to see what's going on once that cellular tissue product's applied. Because
Hmm.
if we're not seeing a progress, there's going to be some questions as to why you either are continuing or what
Hmm.
your next plan of action is going to be. But
Oh,
it
yeah.
also mitigates risk. I know I've been saying that a lot, but it's
Hmm.
true because
Hmm.
measurements tell a huge story about what's going on with the wound. So we
Hmm.
want to make sure that we're consistent with what we're measuring and we're accurate.
Oh my gosh, absolutely. And I will
Mhm.
give a shout out to, a lot of the, new tools that are available
Mhm.
to measure wounds. One of the biggest things that I would always hear is when we were out with home care, right, is, oh gosh, it takes 4 seconds to do the, the measure so
Yeah.
much quicker. But that isn't an accurate measurement. When you use one of those
Mhm.
measurement devices, um, it really gets a much much more accurate measurement of that wound.
Right.
And I really think that we're going to see, I feel, over the next couple of years, it really just is the standard of care that the
Yeah.
paper measuring tape is going to be, you know,
Retired.
retired, and
This is
the
true.
and the measuring devices will be what everybody actually uses. So I think that that's exciting. Well, we've covered right patient. We've
Mhm.
covered right etiology. We've covered right measurement. And there's a lot there.
There's a lot to take in with that and a lot to understand. Right.
Absolutely. So when we meet again, Therese, we're going to carry on with the next three rights, and that is right time, right
Hmm.
product, and right size. And so we'll discuss what that means, and then we'll tie it all together, kind of like you said, of
Hmm.
that systematic approach and that systematic thinking process of when you're ready and what documentation you need to place that CTP.
Absolutely. So thank you all for watching, and we look forward to seeing you soon.
Awesome. Thank you so much, Therese. We'll see you later.
Yes, take care.
Bye.
Bye.